The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. With us, we have an expert on the topic, a board-certified oral and maxillofacial surgeon, Dr. Ornstein. Dr. Ornstein, welcome to the program.
Glad to be here, Randy.
Now, as an oral surgeon, what type of patients do you see? I mean, what are the different categories of patients you see?
We see many different types of patients. Sometimes they're the patient with a single tooth missing, maybe from a sports injury. Kid playing football, knocks out a tooth, comes in, gets the tooth out, gets the implant in the same day. We have patients, maybe they lost their dental insurance, they've been going around for years with neglect, maybe they're afraid, maybe they're in pain, and they come in to have those replaced. And more so lately, we get the patients that have been wearing dentures for many years and are not happy with them. Maybe they're having problems, maybe they're having pain, they're not staying in, they're falling out when they smile.
The dentures fall out?
The dentures fall out. Yeah, so they're coming in for the implants.
And so you do the surgical part of it. And does somebody need, by the way, a referral to see a specialist like you? I mean, do they have to get a referral from their general dentist, or they can just call you directly?
They can call us directly. Most people know they need an implant, especially the people that have become more educated about the implants where it concerns their dentures. They're tired of them falling out. They're tired of using all that glue to hold them in. And
do they tell you this?
They absolutely do.
Okay, so moving on to today's topic, dental implants, who's a candidate? What are the different categories that you see in your office?
There's a range of different types of patients that we see. Sometimes it's a single tooth replacement. It may be from a trauma, like a football injury for a kid at practice or something like that. They'll knock a tooth out, come in, get the tooth taken out and an implant in the same day. That's often possible.
So tooth in a day, by the way, is true when I see some of this type of advertising. On the right candidate, you can do it?
Sounds funky, but it's true.
Really?
Yes, it is.
All right. Okay, so you've got the one tooth, and then what?
Sometimes we have people with several teeth missing. Maybe they wore partial dentures for a few years. Maybe they need a few teeth out. We can do that too. And a lot of times it's people that have, for one reason or the other, not gone to the dentist for years. Maybe they're afraid, had a bad experience, maybe ran out of insurance. And those people are coming in and maybe they need all their teeth out. So a lot of times these days, it's sad. It's a sad day when it happens, but it's true.
You think people put it off too long? They've either been told or they know their teeth have to go and they do nothing? I mean, is there a group out there like that?
I think humans by nature are procrastinators.
I know guys wait till the last second.
For sure.
To do that
I hate
stuff.
to say that, guys, but it's true. And sometimes their wife is the one that went out and got all the information and took them to the office. We say that quite a bit. The women are the watchdogs of the health issues in the family. Then we have the denture wearers, the patients that may be new denture wearers. The upper dentures are a little better to tolerate than the lower dentures, and that's because you have the entire roof of your mouth to hold the denture in. The bottom denture is really pretty tricky, and it's hard to hold that thing in. Your tongue wants to kick it out. It's jiggling around. It's very uncomfortable. So sometimes people will go for maybe a year with a new denture and figure out, wow, I'm sorry I didn't make that decision to get those implants. So they'll come in and get the implants done.
Okay. Now it's become pretty mainstream, is that right?
It has. And some of that is thanks to the internet. People are becoming more educated. They're listening more to shows like this. They want to do better for themselves. We have the baby boomers are blossoming out there now, and they're all getting older. And people are living longer. They want to look better, feel better about themselves. And that's one of the main reasons they come in.
Yeah, now 70 is very young today.
Absolutely.
And that's about the typical age of your patient?
It can be. Unfortunately, I have some younger.
What if they have osteoporosis? You know, I've told this to other doctors, and my mother, 74 years old, says, Randy, you know, I don't care what you say, you know, I'm too old for dental implants. Her medical doctor said that they'll fall out, things like that. I mean, is that a common belief or a common thought? Because we talked and you said, no, that's a common belief. And, you know, that's an interesting question because, you know, why do people have osteoporosis? It affects their hips and, you know, sometimes their jaws. And the bone is different in the upper jaw than it is in the lower jaw. The upper jaw is typically thinner and softer. But here's the deal. If you don't have teeth in there, it doesn't have a job to do. It's unemployed. Okay.
And what does it do? If you're unemployed, you're going to get depressed. You're going to go away. And that's what happens with the bone. Once you put the implants in, that bone is in function again. It actually strengthens their bone. So one of the patients I'm going to show today actually had a problem with osteoporosis. And
Let's take a look. What do you have there? And you say it changes their lives. And I smile, because I feel like sometimes it's a bit of an overstatement, but
Well, yes and no. And you smile, and that's the thing that we change the most.
okay.
And funny thing about a smile, it's the Webster definition is contraction of the muscles around the face to show happiness or pleasure. Really, somebody said it better, and I forget who did the quote, but smile and the whole world smiles with you, and frown and
Okay.
you
All
know the
right.
rest.
Okay,
So
good,
once you
good.
smile, you feel better about yourself, and it's a whole upward curve from there. So this is a lady that came in with dentures. She'd been wearing them for many, many years. Not a particularly old lady, but she had lost her teeth early in life. So what happens when you lose your teeth? As I mentioned before, you lose that bone. She had lost so much bone that when she spoke, her nose actually moved. And
Really? Okay.
yes, and the other thing is there's a nerve in the middle of your jaw, and normally it's protected by your teeth and your bone, but when you lose that bone, what happens? The nerve seems like it floats to the top, and what her denture was doing was sitting on that nerve and causing her pain, burning, numbness. So she was a mess.
So when you hear about denture pain, it is a nerve being exposed?
Sometimes it's just wear and tear on the gum tissue, and the bone actually becomes exposed. Or,
Interesting.
with loss of the bone, the nerve is riding up on top. So it's like having a pinched nerve in your back, except it's under your denture.
Yeah, but isn't that what a reline is when they go to reline their dentures? Does that help or take that away?
Yeah, what it does, it tries to replace the bone that you've lost. But it's an artificial thing, and again, sometimes you end up with this big wad of stuff, and you have a little, what we call a pencil mandible, and that's not a healthy situation.
So it's painful.
It's absolutely painful.
Okay, so with her, what do you do?
She was sort of a challenging case. Not only did she need implants, but she needed something into which to put the implants.
Okay.
So it's kind of like hanging a picture on your wall at home. If you hit the drywall, guess what? You can't hold any weight. It's not going to work out for you. If you hit the stud, you're in great shape. So for this lady, that's what we had to do. We had to rebuild her bone, and then she got 6 implants on the top and 4 on the bottom. This is the result that we got. This is like a whole different lady.
All right, well, she looks pretty happy.
So my son said, no, that's not the same lady when he saw the pictures. But no, this is actually the same lady, but a different lady. What's different about her? She can't stop smiling. This is the lady that deals with the public. And when she first came into the office, she didn't hold her head up. She was a little bitty lady, but her head was always down. And she never wanted to smile because she was worried her denture that was held in with about a tube of adhesive was going to fall out.
So with her again, as a recap, what'd you do?
She got 6 implants on the top and 4 implants on the bottom. There's usually an option when you have this done. You can do a fixed appliance, which is something that kind of screws in, and we have a model of that to show you. Right. This lady opted not to do that. She was a little concerned about how to clean it, things of that nature. So she kind of went the conservative route and wanted to take them out every night and clean it.
So snap in, snap out.
Absolutely. And for her, it was pretty life-changing. She actually started off as a little bit of a diabetic because all she could eat was mushy food that was not necessarily good for you. And after we put those implants in, she actually lost weight. She was able to eat much better, her health improved.
So you could eat chicken or a steak with these snap in, snap out dental implants, right?
You could eat anything you want with these, just
Like
because
a corn on the cob?
Absolutely.
Okay.
And this is what that lady loves. So before, she definitely couldn't do that. She had to cut the kernels off the corn and eat them that way. But now she can eat anything she wants. And like I said, her health has improved because of it. Interesting factor, but...
Now, okay, so denture wearers will watch this program, things like that. And there's, what, thousands, you think, in Texas?
Probably.
100,000 in Texas, people that are wearing dentures. If it's as good as you say it is, why isn't everybody doing it? What is your take on that?
A lot of times these people just don't know it's available. Now, we talked about the internet and people finding out about stuff like this, but a lot of times it's the younger people. Maybe they'll think about their mom or their dad and say, Mom and Dad, I saw this thing on the internet, you think you want to go for that? And they'll come in and ask about that. So a lot of times they just don't know.
So the denture wearers just don't know.
Yeah.
Now terms like no more dentures, do you think that's the future of dentistry? Somewhere along the line that you'll just get your teeth back with dental implants? What are your thoughts on that?
I think that's definitely the trend. These implants are revolutionary. They really do change people's lives. Imagine if you can eat better. A lot of times people come in, they're old, and they think, well, gee, am I too old for this? Why should I do that now at this stage of my life? But why not?
Well, how old could you be to get a dental implant?
If you can walk still, you can come in if you're not, you know,
Okay.
taking, you know, and I'm going to qualify that. I was about to say if you're not taking a lot of medications, you can have implants, but we do have a lot of patients who are older that do take
Like
a lot
in
of
their
medications.
80s, it's
Yes,
not too old for dental implants.
80s, 90s. I had a gentleman who was 91 and insisted on getting implants. His son-in-law was a dentist and introduced him to that, I think, 15 years ago. And now every time he loses a tooth, he comes in for an implant.
Okay.
91 years old.
What about the highly anxious patient? Just the fear of the dentist.
I think that's almost every patient that I see.
Okay.
Everybody that walks in is anxious, nervous, especially the patients that have been wearing dentures for a long time. Well, why did they lose their teeth? Sometimes they get a bad experience when they were a little kid, and they remember that. I had a 75-year-old lady that remembered what happened when she was 6 years old.
At the dentist.
And at the dentist, and she was just terrified.
So what, IV sedation? Is that what you're using?
For the most part, almost everybody is asleep for their implants. Nobody wants to sit there and get needles poked into them and stuff. That's what they hate about the dentist. I mean, let's be honest.
Yeah.
You know, they come in, they don't want to get hurt, they don't want to feel any pain, they don't want to hear the noises. So it's a much more comfortable experience going to sleep.
I mean, is it true that they could actually say, I don't even remember you doing the procedure?
No, what usually happens is they sit there and they go, okay, I'm ready to get started now, but we're already done.
Really?
Yeah.
Okay.
A lot of times we're heading them out the back door and they're like, oh no, wait, I came for surgery. I said, you already had it. It's time
Really?
to go home. Yeah, it's great stuff.
Now we're going to take a quick break, but make sure I get this correctly. This all-on-4, that's 4 implants for a denture wearer to give them something fixed in their mouth, a fixed set of teeth. Is that
Exactly
right?
right. Exactly right. Back in the day, we used to think that you needed more implants to get this done. The thought used to be 6 on the bottom, 8, 9, 10 on the top. But the technology has changed so dramatically that we're able to do the same job with just 4 implants. And the way we can do that, the implants can go in straight in the front and we angle them in the back. And the whole idea is to anchor the whole mouth from front to back. And if you angle the implants and the abutments, then you've got the spread, you've got the stability. So just 4 implants will
What's
do
interesting,
it.
okay, it's good to hear actually from an oral surgeon that this is possible, because anticipating this interview, I've had general dentists that say, Randy, I don't think so. I think you need 6 or 8 implants to give something fixed in their mouth. And
Those
you're
are the
saying-
guys that missed that physics lesson
They mi-
that one day
Okay.
about the levers and the balance. But all it is about stability. Once you have what we call cross-arch stability, you can get that denture to go in and be stable. It's not going to rock. You can do it with 2 implants. And for a lot of patients, that's the option that they choose. Maybe it's a financial reason. Maybe they just don't have quite enough bone. They don't want to go through a grafting procedure. And the 2 implant option is a viable option. You just snap the thing in, snap
2
it out.
implants, snap it. And is that a big change? I mean, can they still eat pretty good with that?
Yes, I mean it's
That's a model right
it's
there,
a
the
shocking
2.
thing. We have the model.
Let me see that.
Here's the model. I'm going to show that to you.
Okay. So
Yeah.
is this accurate? Yeah.
Yeah,
okay.
see, it's pretty
And
tough
my
to get
hands
off,
aren't
isn't
greasy.
it? Yeah.
All right. Okay, so 2 implants right here.
Just
in
2
the lower.
implants. Those are little ball attachments. They
Snaps
snap
in,
on.
snap out.
I had an 85-year-old gentleman. They thought he had cancer because he was dropping weight like a stone. Why was that? He couldn't chew his food. He was just bolting it. He was having stomach issues. He used to vomit. The guy was just wasting away. We put the 2 implants in. That's all his jaw could accommodate because of all the bone loss. Next thing I know, I get a picture of the guy. He's like gained weight. He can't stop smiling. He's taking the pictures with the waitress at the Hooters restaurant. So it changed his life.
And they show you these pictures.
They
to say-
brought the pictures. His daughters became
life has changed
patients
because
of
he-
mine, and yeah,
because
they
he
come
could
with
eat
his picture.
again.
Yeah, he was so happy.
So, is there such thing as a happy denture wearer? I mean, I know a few people that have dentures. I never hear them complain about it at all.
They're not happy.
Really? Okay.
They,
Well, obviously, they're not going to tell me, I guess.
no, they don't tell you. And by the time they come in to tell me, they've really had it. I mean, they may have been at a function. I had a guy who was a coach in a high school, local high school. He's wearing the dentures and he's trying to shout at one of the players. And what happens? His teeth fall out.
Really?
So he's got to cover it up because he can't be weak in front of his football players now. Come on. So, I mean, that was his reasoning for coming in.
Is there usually like a breaking point for these denture wearers that finally say, I got to do something about it?
Right. So it's either a pain situation, maybe that the denture has become so uncomfortable they really just can't tolerate it anymore. You'll be surprised. A lot of women wear dentures for a million years and never take them out in front of their husbands, even when they go to bed. So at some point when it becomes really intolerable, that's when they come in. I mean, they just had enough.
Because 70, 60, I mean, they're still on Match.com, they're dating. I guess, for kissing and things like that would be very uncomfortable.
Absolutely.
Or a
And who
person
wants
could
to
be
do that?
self-conscious about it.
Yeah, so the internet dating thing, I mean, it's...
What are the misconceptions? We're going to take a break, but what are the misconceptions about dental implants that are out there in the denture wear crowd that you hear that just aren't true?
I think the biggest misconception is that you need an implant for every tooth.
Okay.
And then they think you're going to just come in and drill a bunch of holes and screw these things in. They already have teeth on them. That's not really the way it works.
Okay, good. We're going to take a break. We come back, more of those photos. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Up next, more about the process. If you have a loose-fitting denture or are missing just one tooth, you got to see this next segment. We'll be right back. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about dental implants. With us, we have an expert on the topic, a board-certified oral and maxillofacial surgeon, Dr. Ornstein. Okay, so you have photos, and we were discussing at the break about changing people's lives. That for some people, it's life-changing.
We have patients that come in and they people always think they're mad or stuck up or something like that, but it couldn't be further from the truth. Here's a lady that kind of looked that way. Everybody thought she was mad all the time, and for her, she'd been wearing this dentures for about 1 million years. So she came in, she wasn't happy with it, she wouldn't smile because it kept falling out.
So she did have a denture.
She did have a denture, and she was sick of using the adhesive. And that's a thing I want to point out about the adhesive real quick. The latest information on that is that those adhesives contain zinc, and zinc is toxic to the body. So if you're using, a half a tube or a whole tube a day to keep your dentures in, that stuff is making contact with your tissues all the time. And people have crazy medical side effects like tingling, numbness, pain, fatigue, stuff like that. So that's the latest studies about adhesive. So we really need to do something about that, get rid of those dentures and get some implants in. So,
all right.
This lady came in, she didn't have any of those issues, but she wasn't happy, and that's evident in her non-smile. So we put 4 implants in her upper jaw. She said she didn't want to have to stick that thing in the glass at night. At least not both of them. So we put 4 implants on the top. This was a fixed prosthesis, which means...
So it stays in her mouth.
Which means it stays in.
Okay.
We put the 2 in straight in the front, angle the 2 in the back to get that cross-arch stabilization that we talked about, and the thing's screwed in. She doesn't have to worry about it. The other nice thing, and I've got a model of that, that we have here. It doesn't come off, and I'll show that to you.
It's just fixed.
It's just screwed in.
Interesting.
It
Okay,
doesn't come
so
off.
the rear are just angled.
Right.
So it doesn't flip up in the back.
Exactly
Okay,
right.
Good.
And the other great thing about that is that there's no plastic covering up the roof of the mouth.
Okay.
My mom wore a denture for a number of years, and I used to wonder how she could drink the tea with it still bubbling in the cup. It was so hot, and the food was also spicy, she couldn't taste it. She couldn't feel it. So with this technique, there's no plastic covering the roof of your mouth. You can feel the texture of the food. You can taste the food. It's really phenomenal.
Okay, so you gave her that on the upper. What about the lower?
On the lower, she opted to go with the 2 implants, the snap-in,
2
snap-out
implants.
option on the bottom. And that worked great for her. The lady actually had a ton of bones. She had more than usual. I had to take some away. But whatever it takes to make it work. And she was so happy with it. I mean, look at this smile. I mean, you can't believe the
look like
difference.
the same woman.
She actually has a smile now. And so she's very happy with the result. She's more animated. She's confident.
So when you look at the before and after, by the way, when she sees herself for the first time, is it emotional? Can it be emotional? For
Oh,
somebody
good
like
grief,
that?
yes. These patients, sometimes they break down crying. I mean, that's the difference. They've been suffering so long and not really knowing what to expect or, and they're really thankful that it didn't hurt. These patients, they're not going to be taking all this pain medicine. It's worse getting your wisdom teeth out than getting a full mouth of
So it's like having your
implants.
teeth back, by the way.
Absolutely.
Right? I mean, it feels like
It feels
your teeth
real.
are-
They
Okay.
tell me that they haven't had that sensation of chewing and swallowing since they had teeth.
Is this one of those things where a patient might say, I should have done this years ago?
Absolutely.
Do you hear that?
Yeah, they're shocked and amazed that they hadn't done it before, and they're sorry all the wasted years that they spent suffering with these dentures.
Now, on the phone, we talked that if there were a try-in period, somehow, I guess there's not, like on a Friday they come in, they try it for the weekend, that they couldn't go back, that every single denture wearer in Texas would do this if they knew
Oh, absolutely.
the benefits.
There's no question. There's no question. You can never go back. It's the difference between, I don't know what to say. I mean, chewing and not chewing. They're not really chewing when they're having the dentures in.
Okay. Now what is that? That doesn't look too good right there.
Well, this is one of those wonderful cases.
That's a bad one.
You might think that this is something unusual.
It's got to be rare.
It's not rare. It's an everyday thing, and it's not that these people don't care about themselves necessarily, or that they didn't think about it.
Just one tooth on the top.
Yeah, well, there's more than one. They don't look like teeth anymore. I mean, those are what we call things formerly known as teeth, but.
That's okay.
But basically, this is a gentleman that had a partial denture in for many years, and the teeth kept rotting and breaking off. Didn't have insurance for a long time, so he just suffered with it. He was actually holding his partial up with his tongue when he came in. So he come to see me and said, well, Doc, my dentist says I need another tooth out. So that's what he was doing. All of his life, he kept bending down and not talking. He certainly didn't smile. I mean, would you smile if you had that in front of you? No. So he was extremely self-conscious, very fidgety. And
so what did you do for him?
So I told him, look, I don't think you need one tooth out. I think you need them all out.
So those teeth had to go.
These teeth definitely have to go. There wasn't any option. And he thought about it for a little while. And in the 1 week and he was thinking about it, another one broke off, and he called me back and said, Doc, you were just so right. I'm ready to go.
All right.
So he came in. We took the teeth out. He got 4 implants on the top and fixed prosthesis again. We screwed it in. And he wanted to start out with that at first. I said, okay, we can do that.
So a denture on the lower and then just something...
No, he kept the bottom teeth. He wasn't ready to let everything go. This is a very cautious fella. He was very OCD, computer-type guy, and he just wanted to make sure that he knew what he was getting into. So he came back in and got the 4 implants on the bottom, took the teeth out, and the implants went in the same time. Back in the day, it used to be you had to take the teeth out and you had to wait. You'd wear a temporary denture, and then you'd come back for the implants. Nowadays, that's not the case. You'll come in, you'll have all the teeth taken out, you'll have the implants put in, and very often you can have those teeth put in the very same day.
So they can walk out with a set of teeth?
Absolutely.
Okay.
You come in the morning, we'll do the surgery. Oftentimes the lab guy will come in, the treating dentist will be there, and you can get your teeth screwed and you leave with teeth.
So that's him right there on the after?
That's him, and it's sort of amazing to see. He actually can't keep his mouth shut now.
He's smiling all the time.
He's smiling all the time. He wants to show all of his teeth, top and bottom. He's very proud of them, and it has changed his life. So this is a fellow who never used to look up, never used to smile because he was holding his partial up with his teeth, remember? So now he's feeling great.
But there's a lot of people probably like this guy, right?
There's a lot of
so
them
just
out
what
there.
is it, the fear of the dentist?
A lot of times
fear
it's
of
fear.
pain?
A lot of times the pain thing is a huge thing because remember we talked about people with bad experiences.
Did he complain about pain? Do you remember?
Not really. He wasn't complaining of pain, but he was non-functional.
Meaning he couldn't eat?
He couldn't eat. His partial kept falling out. He was holding up with his tongue, so his speech was impaired. Imagine if you try to hold up a lifesaver in the roof of your mouth all day and try to speak. I mean, you wouldn't be the great newscasters you are now.
Well, thank you very much. It's very nice. Now, we are out of time, but I know you have a few more photos. What are we looking at there?
We're going to show one more lady. This is a clinical picture. There's no teeth in the front. And
So that's upper.
This is the upper, and it's hard to tell sometimes looking at these pictures if you're not in the biz. This is her with her partial denture in. What you may notice is that you see those ugly metal clasps on the side of her mouth where they hook in. You see the teeth sort of flaring out in the front. Her lip is sort of curled down, and she's not really happy with the way it looks. It doesn't look real feminine. She's just not happy. And they didn't fit real well after a while. Everything moves around when you don't have teeth. And these partials are plastic. So what happens is they wear away, as well as your bone wearing away. And so this is a problem. So we took this lady and we didn't replace every single tooth. And that's another misconception people have. They think it's a one-to-one replacement, so it's going to cost me a fortune. That's not true. So for her, we did every other tooth. And this is her final result. So this is a lady now that looks
totally
fabulous.
Different.
She's totally different.
That's an extreme makeover.
She's got lips that look very feminine. They're very attractive. She's got a nice wide smile, and she's not hesitating to smile now. She's not showing those ugly metal clasps on the side, and it's totally changed this lady's life.
How do people hear about you, by the way?
A lot of times they hear about me on the internet. We have a nice website.
They look up dental implants.
Yes, and or surgeons in the area, and they find us. They research everything. They call, and sometimes we're the second or third opinion. But oftentimes most of the time, we can get the patients to stay with us.
Okay, and you're very interesting. You say you survey, you send out surveys on their experience.
We do. My facility is actually an accredited facility. It's accredited by the American Association of Ambulatory Healthcare. And what that means is that our standards are higher than pretty much everybody else's.
So with these surveys, I mean, what's the stats then about their overall experience?
They love it. They love the staff. They love the surroundings. So we have a very nice office with wonderful views. But we have very good ratings. And the only thing they may complain about, maybe they have to wait a little bit longer. And why is that? Sometimes people like to talk and they want to feel comfortable. So I may have to spend a little extra time with them. I'm not afraid to do that.
Of all areas of dentistry, you know, as an oral surgeon, you do a lot of complex stuff. Would you say that the dental implant crowd is the happiest group of patients? When you give somebody, you know, the denture wear, and now they have teeth and they can chew?
Absolutely.
You think so?
Absolutely. Without a question. Because these patients were what we call dental cripples before.
Okay.
Yeah, it's an awful way to say it. But if you're having pain all the time, you can't chew your food, that's not the way to go. You have indigestion problems. By the time they come in and they can chew, and it makes them feel young again. The
Really?
older patients, they do. They have a new lease on life. They have a spring in their step. They've changed their hairdo.
Just because of their teeth?
Just because of their teeth. A silly thing, but true. You know, it's a
Okay.
fundamental to human
Now, you're
nature.
a dentist, though. Of course you think the smile is important.
Well, of course it is. It's the window to the soul.
All right, all right.
And you have a great smile, so you're not
Thank you.
complaining.
That's right. Okay. I guess I am insensitive to it. I have my hair too, right? But for these people, you give them their teeth back, and their whole life changes.
Their life
You say.
certainly changes. And the smile is one of the most important aspects of human nature. It just makes you feel good. It makes you feel well.
Okay, your take-home message. Somebody watching this, they're missing teeth. They've been told their teeth have to go, or they're a denture wear. What's their first move? What do you
Don't be
tell them?
afraid. Come on in. Give us a call. We can help you.
All right. I want to thank you for coming on the show. Very interesting.
My pleasure.
Good for you. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again, you could go online on wellnesshour.com and you could put in Dr. Ornstein's name or dental implants. You'll find her that way. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.